Sweden is prioritizing herd immunity, a strategy that was considered by other countries but abandoned because it would overload healthcare systems.
But the government...
What if I told you there was another way to have dealt with the coronavirus?
Herd immunity.
It's called herd immunity, and opinions are mixed. First off, let's define herd immunity. It starts with a healthy population getting sick. Then those who have been sick gain immunity. Eventually, enough people have immunity to stop the spread. In a sense, it's the complete opposite of social distancing, where people are separated to slow the spread of a virus. As you can see, through social distancing, disease is not spread to one another because there's physical space between them. Herd immunity encourages interaction to spread the disease so people can build immunity. While many infectious disease experts and government officials have shot down the idea of herd immunity, the idea actually came from an infectious disease expert.
On the other hand, children do very well with these diseases. They're evolutionarily designed to be
This is Knut Witkowski, formerly the head of the Department of Biostatistics, Epidemiology, and Research Design at Rockefeller University in New York City.
And infecting each other, then that contributes to herd immunity. About 80% of the people need to have had contact with the virus, and the majority of them won't even have recognized that they were infected, or they had very, very mild symptoms, especially if they're children. So it's very important to keep the schools open and kids mingling to spread the virus, to get herd immunity as fast as possible. Well, what people are trying to do is to flatten the curve. I don't really know why, but what happens if you flatten the curve, you also prolong to widen it, and it takes more time. I don't see a good reason for a respiratory disease to stay in the population longer than necessary.
After this interview and some others, Rockefeller University issued a statement saying Witkowski doesn't represent Rockefellers. But Witkowski wasn't the only infectious disease expert to talk about herd immunity.
If we're starting with a population where no one is immune to this virus, which is what we assume, we can get to high levels of immunity, which will basically drive down transmission and prevent infection through at least two ways. One is vaccination, if and when we have a safe and effective vaccine. And the other is that basically much of the population is immune. We call that herd immunity. Basically, you get reduced circulation because the virus just can't be transmitted to people who are immune. We would rather do it through a vaccine, but a vaccine is not going to be here in time to allow us to do that at least for 12 to 18 months. So.
The idea was proposed a few weeks back by 2 Nebraska senators as an alternative strategy. In the Hastings Tribune, Steve Halloran and Steve Erdman said they were tired of seeing the economic impacts caused by social distancing. That idea prompted some questions of Nebraska experts, and most of them say the same thing.
A suggestion by 2 state senators who encourage people to come in contact with the virus and build herd immunity. Good idea, bad idea?
I don't think that's a good idea. It's not necessarily the individual who's healthy that we're worried about. It's the ones who they're in contact with. So I don't think that's a good idea.
Dr. Khan?
She's spot on. So unfortunately, herd immunity means 60 to 80% of Americans infected. So think about what happened in New York City with a small proportion of people infected. Multiply that to 60 to 80% of the whole country infected. So no, that's I'm really glad we took the approach that we took across the United States, including here in Nebraska, to social distance.
If we follow the concept of herd immunity and we let everybody get sick quickly, we still have the capacity, especially here, to overrun our healthcare systems and have a surge and a peak that is much higher than we want.
The big key, again, is what we've said all along, which is about making sure that we don't overwhelm the healthcare system.
Hindsight is always 20/20. Will we have wished herd immunity was the preferred method? Only time will tell.